Welcome to Healthcare IT Today. I'm John Lynn, together with my special guest host and friend, Brittany Quemby. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. In today's episode, we'll be discussing women's health IT. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at BritLQ. Plus, check out our 17 years of health IT blog content at healthcareittoday.com. I'm so excited to have you here, Brittany. First time, long time member of Healthcare IT Today, and appropriate that we have a woman on to talk about women's health IT, right?
Yeah, long time listener, first time on. And you know me, I love this stuff too. So.
That's true. Well, I mean, I'm excited to have you here, because I think it is good to have a women's perspective when we're talking about women's health IT. Colin and I could do certain things, but certainly don't have your perspective. So talk to us, like, how can technologies like telemedicine, digital health apps empower women to manage their own health and well-being? And maybe let's talk about some of the challenges or disparities that we should be mindful of when implementing these.
For sure. And I, from my own experience as a busy mom, I just had a baby a year ago, which is wild to think. But, I think digital app services and telemedicine services can really empower women by providing extremely convenient and easy access to things like healthcare resources or information, or just access to someone to talk to. Like typically as a woman, our health comes last in the household. It's typically the kids or your partner or your husband. They typically come first and then we come last and we get put on the back burner. So, when we have the time to take care of ourselves, as it goes down the list, we need things that are, easy and efficiently available to be able to monitor our own health. So things to get access to medical advice or manage our conditions just from the comfort of our own home, or when we're on the go, taking kids to school. So I think that's one of the most important things, just easy access and accessible. I think in terms of challenges, I think two of the really big things that need to be addressed is, ensuring equitable access, especially of those who are in communities who might not necessarily have, a cell phone or technology to be able to access that care, or even transportation, right? It needs to be inclusive of kind of everyone in those diverse communities. So I think it's crucial to design those apps and these types of technologies with that in mind, to benefit all women.
I think it's interesting you talk about that, because when I looked at this and I thought about, okay, has technology and this tech solutions been a next positive or negative for women? Like, to me, it was overwhelmingly positive. Now, there's some of them that aren't tailored to the needs of women, and I think we're going to get to that in that discussion as far as the unique needs of women. That I think that's a fair criticism of technology. But when I look at something like telemedicine, like, women overwhelmingly love it, right? Like, I know enough because I care for my kids and I hate taking them to the pediatrician, and especially when you got a couple like you do as well, right? Like, you got to bring the other one with you, where it's like at home, telemedicine, way better. They can sit there and play with their toys, they can be themselves, they can watch the TV, they can do whatever, right? While you're, having a telehealth visit with the other child. And that is just so much easier than this whole rigmarole of going into the office, especially when you get in there and then the doctor doesn't even touch your kid or doesn't even do anything. They just need to inform you of an update or something. That's really frustrating. And I think that's true of many digital health apps as well, is that they're overwhelmingly a positive change for the needs of many women. And so overall I look at it and I'm like, yeah, this is a powerful thing. And you're right, there are socioeconomic things that are challenging, although it's surprising how many homeless people have cell phones, right? Like, it's
true
shocking the difference that's even making.
Yeah. And I even think, going above and beyond that, as you mentioned, you kind of just triggered something in my head, is a telemedicine visit, is basically equal to going in there. They're not doing much different other than, being, there's no really physical touch either when you're going into an office. But I was saying to my husband the other day, even just prescribing over telemedicine, because, sometimes they won't do specific prescribing over telemedicine. But what's the difference if it's the same thing going in versus, virtual? So I think that's kind of the next step, that, they won't prescribe an antibiotic, unless it's you're going in for a specific, condition. So, what's that next step where it makes it even that much easier?
Yeah. Yeah. And my fiance had that where she needed a follow-up visit. And thankfully the doctor understood the needs. And he's like, this is going to be a quick visit. We can do it telehealth, right? And sure, I was trying to join in to see if I could join remotely, which was a separate discussion, right? Like it didn't quite do it, but she texted me before I could join and she's like, yeah, we're already done. And I'm like, all right, well, I missed it, but but it was so convenient for her and for the doctor, to just hop on, do the quick visit, it just saves so much time. But I think the challenge though, it comes to like many of the digital health solutions don't keep women in mind, right? Like, so let's talk about that and how these IT solutions be tailored to address specific women's health needs. I mean, there's the big three, if you will, right? Pregnancy, which is very specific to women, postpartum as well, and menopause, although I think there's some postpartum type stuff for men too.
Yeah.
But and then menopause, of course, which is a very female thing. What role can we play in optimizing these women's health experiences? Because to be fair, they haven't today, right? Like when we look at the investment, go look at the investment. It hasn't been on these women's health solutions. Go look at the research and the studies. A lot of women weren't even included. In fact, they often didn't include pregnant women because of risks and other things.
Totally. And you hit on like some awesome points. So thank you for doing that. But, I think first and foremost, the funding has to be there. So I read a stat recently that said that research and development for women's health obviously is super underfunded. And while we make up almost half of the world's population, maybe even more now, only 1% of research spending goes towards female specific conditions that aren't like related to cancer, which, makes up a large portion of our life, other than, other specific diseases like cancer. But, historically, they haven't been, doing research on women's bodies. A lot of it was just testing on male bodies and those trials. And I think recently, or not recently, but historically, the female participants in clinical studies only started in like the 80s or something, and then was only mandated in 1993 to start including women in these studies to then get funding for specific solutions. So, I think that's kind of where we need to start, is funding needs to be critical for women's issues and women's health, and having women at the table when it comes to funding research and leadership, can really improve patient care for women, especially when it comes to technologies that are being built, even just AI algorithms and machine learning. Just having women within those processes can then help the outcomes and kind of what we're developing.
Yeah, I mean, that stat's interesting, but I'll play a little devil's advocate. Hopefully I won't anger too many people, but the interesting question is, I wonder what the stat is for male specific studies. And your argument's interesting as well, that, well, the 99% is all male. Someone could make that case. As I said, I think women have been underrepresented in many of the studies that have been done, but many of the studies out there aren't gender specific, and they apply to women and men equally, and so I wonder what percentage are male specific studies, because that would tell us something even more, right? Like, were there a bunch of studies about male specific challenges, and was there a lot of investment in that, because the investment dollars come from men? Like I said, sure, we need to improve. There's two problems. One is women weren't represented in the other 99%, right? And that's a problem that needs to be addressed. But maybe more importantly to me is those 99% of studies weren't going after the things that impact women and women's health in a
Mhm.
massive way. Right.
Mhm.
And I actually discovered this when I don't even know if you know this story, Brittany. I don't know if I've told you, but I almost started a women's period tracking app.
Mm.
This was probably a decade, maybe more, 12, 14 years ago. I
Right.
was, working with this lady, and she enlightened me on the fact that we know very little about women's health.
Nothing.
And we
Mhm.
just kind of chalk it up to, oh, well, she's in pain. Well, it's her period. Of course she should be
Right.
in pain. And she's
Right.
like, no, that's not right. And that's not true. And that's not fair. Like,
Mhm.
sure, there is some uncomfortable parts of having, a period, but it doesn't have to be that way. There are solutions, or there should be. If we researched them, we might be able to improve what that looks like for a lot of
Yep.
women. And so we almost started it. It ended up, we couldn't quite come to terms, as far as what we would do and what she would do and what her vision was and what our vision was. But
Mm.
I realized, oh yeah, it's true. We don't address that. We just are like, well, it's part of the cycle. It's part of the
Yeah.
process. And he's like, no, that's not fair.
Mhm. Well, and I think some of, I think obviously we're not where we need to be, but I think some technologies and some apps are really, pushing the boundaries of having women, to help to develop them, to give their unique experiences and their foresight into what needs to be looked at. Like, it's not maybe just part of that cycle, and challenging, I saw recently they're challenging that 28-day cycle, because women these days, maybe back in the day they had 28-day cycles, but these days that's not a normal cycle, and things that are happening within it are now different, 30 years later, or however long we are since they had first existed. But I think it's important to have that someone at the table who can, really represent how we're feeling or what we're feeling as we kind of develop these technologies to really give that personalized experience.
Well, and that's kind of my whole point. Like, do we even know what normal is?
No.
Like, we haven't invested the dollars to even understand the problem,
Exactly.
to be able to say what is normal. And because I think you're right. Like, I mean, there's 7 billion people in the world. There's
Hmm.
different, health behaviors. There's different genetic makeup. Like, there's so many, and yet we have
Hmm.
almost no insight other than, like you said, oh yeah, every 28 days is about right. Like,
Hmm.
that's not science, right? Like, that's not how you approach a problem.
Right. Well, and even like, this isn't technology wise, but just, I mean, kind of is, I guess. But I read the other day that the man who invented the tampon had basically invented it based on the hypothesis, not the hypothesis, but basically tested it with water instead of blood, which doesn't have the same consistency. And we're still using it today. So it's like, why not 30 years later are we not investing in maybe doing some additional trials on what it actually should be, and developing something maybe a little bit better? But
Yeah, I mean, it's an interesting question, and there is a lot of, you actually saw it at CES. They actually had some period tracking things,
mm,
some
hmm,
that would follow that, and also they also had it for birth, right?
yeah.
As far as, are you pregnant or not, and tying that to a digital health app. And then
Hmm.
of course, Withings had a interesting tracker that would actually measure your urine. When you'd
Hmm.
go to the restroom, you would essentially urinate on their device, and it would capture it and do essentially a lab test in your toilet, which is crazy to
Huh.
think about. You can check it out at Healthcare IT Today, search for Withings, and you see that, it's actually doing the measurement. And one of the first use cases was women's health, which was pretty
Hmm.
awesome,
Hmm.
to measure, I think it was pH levels or something like that. I have
Right.
to look at the thing, but and so, like, there has been a little progress, right, and
Sure.
enabling like the understanding of it.
Hmm.
But I think we all know that we need a lot more testing and investment
Hmm.
in those
Yeah.
areas. So
We'll get there, hopefully.
yeah. Well, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and special guest host Brittany Quemby. Today we're talking about women's health IT. So tell me, Brittany, how can data analytics and IT tools kind of help identify and mitigate the disparities in women's health, and ultimately, promote more equitable access to quality care?
For sure. And you're the data guy, so I'm sure you have, more answers than I do. But, I think we touched on it a little bit, is just really analyzing larger, data sets and really pinpointing the differences in health outcomes amongst different demographic groups. So, I think first recognizing that there are differences, and, we really need to build tools and take into consideration these different measures to make equitable access to care for different populations. So I think I remember reading a stat just about COVID, and it'll be out of my brain right now, but just not considering those bigger data sets in, as we're kind of looking further down the line, is really doing a disservice to kind of everyone. So really kind of looking at that data and encompassing it into the journey, I think, is important.
Yeah, and it's interesting because we hear all about, like you even said, women are 50% or more, likely more because they live longer and things like that. But like that they're more. So you would think that just by sheer statistical numbers, women should be represented in the data that's out there and the analytics tools that are there, but it turns out it's not, because of the way the structure of the system collects data. Now I think that's going to get better, especially as we use more real world data, because the people showing up to the hospital are a mix of gender. It's not gender discriminatory, although it's interesting. I'm still chewing on your comment that many women avoid care because they worry about everyone else first. So maybe there's some of that, although it reminds me of the farmer story, right? That the farmers in the ER and the ER docs freaking out. What's the farmer doing here? They said, well, his wife told him he had to go because he wouldn't go on his own, right? Like, so I maybe avoiding care is somewhat gender neutral.
Yeah.
But who wants to go to healthcare? I know I don't. But yeah, I mean, so I think maybe the real world data will help to improve that, and I'm hopeful that will. I'm also reminded of Visual DX, who taught me, Visual DX does this tool that analyzes your skin for various diseases and other diagnoses. And what they realized is they didn't have a lot of people of color in their data set. And so they had to make a concerted effort to include that, so that they made sure that their algorithms and their AI analyzing of these images was actually effective and didn't cause health disparities, and didn't, because it presented differently in a person of color versus, a white male, right? And so, to me, that's the core element that they taught me was you have to make a purposeful effort to include diverse set of data, in this case women, as we talk about, to make sure that they're part of the clinical trial, that they're part of the data set, and so that we're evaluating it.
Agreed. And I you say the company there was another company, and again, I won't be able to remember the name, but just in terms of doing skin analysis, that it just wouldn't penetrate certain skin. So, women's skin is different, men's skin, people of color have different skin. So that wasn't taken into consideration during the clinical trials. And so it just wasn't, either working properly, or it was working differently, and they were getting, not consistent types of data. So yeah, really developing tools and solutions that can work on everybody.
Yeah, so this isn't a women's health solution, but it is an interesting technology solution that addresses a unique situation for women, although it could potentially apply to some men. When I was working in a data center, we had a palm reader, right? And then you'd put your palm up, and that's how you'd access the data center as part of their security efforts, right? Well, what they taught us is that it turns out it learns your hand over time, and because your hand evolves. And they said, for example, when a woman's pregnant, she often gets more bloated. And so her hand becomes bigger and stretches in different ways. And so, but luckily the technology took that into account. that,
Mm,
hey, that when you're pregnant, it's going to learn that your hand's bloating. And then, of course, after you have the baby, then it's going to go smaller. And the technology takes that into account and understands some variation that's associated with your hand and that biometric
mm,
handprint, which is, it's like, I would have
mm.
never thought about such a thing. Right.
No, no.
But it was cool that they'd taken that into account, that, hey, the biometrics, changes over time. And so we need to constantly update this in order
Right.
to do it. So I thought it was a great example of, taking into account some of the unique, challenges that women face.
For sure. And we kind of talk about, these health IT companies and the things that they're doing. The last kind of question that I have is, how can these companies work with healthcare providers to collaborate, to develop solutions for women's health or health in general to improve the overall quality for women's healthcare, and that also address those unique health challenges that women face?
Yeah, it's a good question. And, I often think about all the statistics everyone always shares about, that, women are the main decision makers in healthcare. It always rubs me slightly wrong, since I feel like I'm involved in my kids as well. It's but I get it, right? It is true that, and even in my case, my kid's mom often does take them to the clinics and stuff. So I think that's maybe the first step, is realizing that they're an incredible, important part of the decision making process. So it reminds me of, shout out to Jen Horan, Jeff and Savvy Co-op, and their hashtag Ask Patients, right? It's almost like we need a hashtag Ask Women, right?
Mm,
Like, and kind of understand what they need, and we need to listen to women and understand how they have a different experience than maybe, the male developer that's writing that digital health app, or whoever it might be. So I guess that's the first place I would start, is let's ask women, let's incorporate them into our boards, let's incorporate them into our committees that are evaluating technology, because I think you'll get a different perspective. Just like when you incorporate patients, you
mm.
get a different perspective.
I agree totally. And there are a ton of, I think, women communities that we can kind of glean that, those experiences and those challenges and that kind of dialogue from, even just from some of the health apps that I've used, during my health journey. The discussion boards, I think, are where most of that experience and those, um, that information can come from, because people are just, dialoguing with one another, having conversations. So I agree, having women be a part of that conversation, but also listening to, the conversations that women are having, just in general, I think will be very important to be able to kind of help, scale those technologies to help, healthcare for women overall.
Yeah, and I mean, I think about the discussions of venture capitalists, right, which drive a lot of the funding for the innovation, the research, the
Mhm.
development of these solutions. And we're seeing a bit of a shift, right? I mean, we're seeing a lot of women VCs in healthcare that are
Mhm.
driving some of that change. It's certainly not enough. When you look at the numbers, it's still far below what it should be. But we see some people that are doing admirable work. I
Mhm.
think of Christina Farr, and a whole
Mhm.
group of people like that are making a concerted effort to fund the women and fund the entrepreneurs that are building these solutions for them. But like, there's a common thing that goes up, right? The venture capitalist mentality is, I need a big addressable market, right?
Mhm.
And then and it makes sense when you come and you say, hey, I want to create an app just for dermatologists. They're like, oof, that's a
Mhm.
small market, right?
Mhm.
Well, the problem is, many VCs say, you want to create an app for women. Oof, you just cut my market in half. You're like,
Mhm.
but no, like, the market is still like half, right?
Yeah,
Like,
why not? Mhm.
that's a huge addressable market, right? So it's not fair to say that, unlike, pediatric dermatology, right? Okay, that would be a
Right.
small market, and a venture capitalist would have some questions about, is that a huge market opportunity, with
Mhm.
the total addressable market being large, right? Whereas when you say a woman's health application, that's 50% of women. That could be a very large market, so I think that's a mindset that needs to change as well, to be able to overcome some of these generic healthcare issues. Because if you're doing some sort of menopause application, that's not a small market. Every woman is going to face that at some point, right? And so, understanding that, and understanding that that is a big market, and you could create a large application that's successful, is probably a mindset that could shift, and then would be able to address things like menopause.
For sure. And, women are looking for it too, as women, I don't want to say for all women, but we are community driven. We are looking to connect with other people. We are looking for those connections. We're looking for answers. We're trying to problem solve. So, when we get into a community or a technology where we can kind of share those experiences and understand those experiences and get knowledge and experience from other people, I feel we thrive on that. So, like I said, yeah, maybe it's half of the population, but it's also half of the population who is down and willing to, be an active participant.
It's funny you say that, because I was really angry that I wasn't able to do the period tracking app, and we needed the woman, and she wanted to incorporate labs. I mean, it was really a cool vision. I think we could have executed. And the reason I was so excited was exactly what you said. All these women talk to each other, right? You go to all these mommy bloggers and have them write about it. Like, you could spread the word about this if you're actually making a difference in people's lives. Like, this is an easy thing to market and spread. So, I still regret that we didn't do it, but
there's still time.
There's some out there that have really, I don't know how well they've done, but you're right. There is still opportunity, because the problem itself hasn't been addressed fully. They've done some side things, but they haven't really understood the problem. So, well, unfortunately, that we're all out of time, but thanks to all of you who tuned into this episode of Healthcare IT Today. Find more details about the show. It's by checking out the programs page on healthcarenowradio.com, and share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm John Lynn with my friend and guest co-host Brittany Quemby. Thanks for listening, and have a great week.